Hello, I'm Professor Gil Zalsman. I'm the director of Geha Mental Health Center, affiliated to Tel Aviv University in Israel. And I'm also a member of the board of the ECNP. Our hearts is with our friends all over Europe that are struggling with this terrible epidemic. Let me say a few words about suicide in Corona time. I'm also chairing the National Committee for Suicide Prevention in Israel, and I'm studying suicide behavior for about 23 years. Interestingly, suicidal behavior go down in times of crisis. And we have seen it even looking over a century, that during World War II, during other wars, during extreme crisis, people much less commit suicide. And interestingly, it seemed like if you have internal turmoil and you have lots of stresses and pain, once the outside world is in huge pain and turmoil, you give up a little your inside turmoil and you are tuned to the outside turmoil. So actually, in times of crisis, suicide usually goes down. We don't know what happens in epidemics like this because we didn't have it for about 100 years. But it seemed like maybe we have less suicides now. Right now, people are more at home. Families are together, so they have better support. However, we expect that down the line, this is going to be changed. And the reason it will be changed is, first of all, the tension will go up. More people will die or need respirators, and it will be really tough. It seemed like being with your family for a long time is also a stressful situation. It seemed like the services are not so well functioning. The more corona patients will be there, less available services will be there. We're not seeing patients face to face anymore. So lots of psychiatry is done by telepsychiatry, which is not bad, but it's not the same as face to face. And some therapists and physicians are sick or isolated, so patients will don't have their therapist around. And all these things, together with less good treatment, will make people more depressed, more anxious, and more suicidal. So we expect along the line to have a raise in suicidality. We have seen some extreme cases of health practitioners that couldn't stand it anymore and committed suicide recently. And as always with suicidality, we have shown in our Lancet psychiatry paper in 2016, sponsored by ECNP, that all the ECNP experts that sat together to study what really helps in preventing suicide came to the conclusion that evidence-based, there are 4 major strategies. And I think these strategies are true also for Corona times. The first strategy is treat depression early and aggressively, either psychotherapy or by medications. But treating depression both by psychotherapy and medications can be very effective. It has to be early, down the depression. Don't wait until the patient is really suicidal. Start it early and aggressively. Give enough dosage. Young people need even double dosage because they are rapid metabolizers, a very healthy, strong liver. Don't give them 20 milligrams fluoxetine forever. If it doesn't work, go to 40 and so on. So treat depression is the first recommendation. The second recommendation is the continuity of care. If you see a patient and then you become sick, you can't see him anymore, send the patient to someone else, make sure they will get there. Because if the care is not continuous, the patient can commit suicide. This is by the healthcare professional. In the national level, the 2 best strategies that have shown in our Lancet paper are prevention of or restriction of means. Don't leave in home guns, pills that are dangerous, put bars on the window of someone who is suicidal, and try to avoid approach to means of suicide. This is very effective strategy. It's true every day. It's even more true when people are locked at home for a long period. The fourth strategy is working with kids at schools Unfortunately, most countries' schools are still closed, but we should work with young people, especially in the 10th grade or ninth grade, talking to them about their feelings, asking them about suicide, and remember, and this is my most important message, asking about suicide will not make anyone commit suicide. People don't kill themselves because you ask them. If they don't think about it, they don't care that you ask. If they think about it, asking will give them a relief and they will share their feelings, they will feel less lonely, and they will ask for help. So asking about suicide is a very important approach. Take care and keep yourself healthy. Bye.